I'll do it.
And then some other things to be mindful of is prior to getting sterile, go ahead and do all of what we call the dirty work. So I would put on some clean gloves. See any XLs nearby or larges? If I can steal some. Perfect. Thank you, Natalie. So we're going to do all of our dirty work. So I've done all the knock. Hi, my name's Seth, nurse taking care of you today. It's time that we do some tracheostomy care. We've provided hyper oxygenated our patient. I have an O2 probe sat on their finger so that I can monitor their tolerance throughout the procedure. All right. Also thinking of pre-steps, what's something else good that we could do assessment-wise right here? I love it. Thank you, Amber. So yes, I would expect with thick oral secretions. Well, that'd be a little fine particular. I like rhonchi. That's the most common you're going to have for the mucousy sounds. So, but either way, you could have rhonchi, maybe crackles. Then after our procedure, because how are you going to know how many times you need to do it until you get a better lung sound? So if after your first wave of 3, we don't get them where we need them to be, we can do additional rounds of suction as the patient recovers. Other things I'm going to do, but I'm going to cheat because I'm going to take advantage of Sam. We're going to go ahead and cut on our suction to regular. How many millimeters of mercury do we like?
Is it on?
It should be. That's the intermittent. Flip it the other way. There you go. All right, mercury where?
Between the green and the red. Yellow.
I like green and yellow. Okay, but between 80 and 120 for an adult patient. And so, and thankfully we already have our tubing over here ready. You can also test it if you're worried that it's not going to suction. You can test it, all the things. So we have that ready. Other things that you can do while you still have on your dirty gloves, which, grab it. I knew there was a reason I asked you to grab it, and I left it anyway. This one's a twist and lock. So also a part of the dirty work, we could go ahead and remove our inner cannula. And for our sake, we're going to say that all of them are disposable. So there will not be any for re-cleaning with us for validation, but we'll talk about if you do have ones, like if you work in long-term care, that's very common that they'll re-clean because it's an added expense for the home. So they'll re-clean there, and we'll talk about that when we get to the kits. And you can also go ahead and remove your old drape. We're going to try for check-off purposes to have you some looser ones. Understand that today some of them may be tight because your peers tied these, not us, so they might be a little tighter today. You're going to be nice. You're going to pay it ahead for the person that goes to validation after you. We're going to tie a little looser than we really would so that it's easy to place that new gauze under there. All right. So since the airway, sterile tract, after you've done those things for prep, we're going to get rid of our old gloves, performed hand hygiene, and we're going to start working through our different kits. So our suction portion will come first. Most of your kits should have some type of fluid or solution in there, typically sterile saline, but we'll see some other variations, but that's the one we'll see. So remembering from our sterile lab that if you're reusing a large bottle, what do we have to do first? Lip. So I would remove my cap. We would lip and pour, just talking about that so I can just do it when we get in there. If you're using your brand new bottle, remember when you're peeling that seal to step away just in case there's some splatter and it doesn't get over in your sterile film. All right, so we're going to use our suction one first. And just to get you some square footage, get other things you don't need out of the way. And so that way we can work out of it. I like this particular kit because we see that my box to fill is on the outside of my sterile kit. That's my personal favorite because once I get sterile, it's very hard to open a reusable bottle once you're sterile. So we like this particular kit, but we're going to work through if you have another. So the open side to side, just to eliminate any flow by. I can bring my sterile pack out. Garbage. So then we're going to touch the outside of the box only because my sterile part's going to be the inside. Some of your kits might have the Medline logo And so that'll help you know which direction is up and where your opening's gonna be, because I've seen students before that have the Medline one. They open it upside down and then they go to pour their water, there's nothing there to catch it. So for these, obviously the plastic or the shiny side is gonna be the side that'll go up. Medline, make sure you can read the logo Medline. So then I'm gonna open our box up, just touching the edges. I'm gonna set it on the corner. As we said, if I needed to lip over where you can, and then we're gonna pour a little bit of water in there, and that'll be for our suction in just a bit. And then at this point, we would sterile glove, which I'll get sterile and move. See how it appears. So I'm gonna get sterile. I'm gonna move them out of the way. So we're gonna trade places. See, it does it to us too, y'all. And then we'll get into our little section in just a minute. Maybe it will stay. No promises. You see how this one starts to stick? Where can I touch to get it off?
Just the cup.
I can touch right there on the cup that I'm gonna go to if the packaging sticks, because they will. Same there. All right. And then we're gonna go inside. I'm gonna touch this to get that cuff. See how the cuff's down? So I'm gonna touch with the dirty side of that cuff to get it started for me. And I can go in there. Goes out of the way. Fine. We can move that one. Back in the kit. Move those out of the way. All right, inside of here, you're gonna have, just like when you're removing the Foley, get control, because sometimes they're loosey-goosey. And then once I touch this tube over here, what happens?
It's sterile.
Right, so I'm far away. So look at here, I can use my feet and I can move my field to where I can see. That's one thing y'all sometimes might forget. Get that furniture where you can move it. So now I'm contaminated with this hand, but I'm gonna stick in to the suction and we're gonna test to make sure we're working. So we're gonna cover our hole. And I see it pulling over there behind Sam, so we're good to go. Now, this is gonna be the difficult part. So when you're sterile, think about a lot of times you're gonna get close and you're gonna brush the gown, so be mindful of that as a potential danger. You're also, when you're feeding your Foley, you may touch the actual face plate or the stomal opening, which would contaminate this hand. So lots of opportunity to contaminate, but you're mindful of those, and we're gonna miss. So we're gonna clean one more time. And so I'm gonna sharpshoot and text. I'm gonna aim for the center. We're gonna spider walk in. When do I stop? When I meet resistance or the patient begins to cough continuously. So then I'm gonna start intermittent suctioning, spiraling on my way out, because that's gonna try to break up anything in there that may be going on. How long should each pass take?
15 seconds.
Around 15 seconds, no more than, because you're pulling out all the oxygen as you suction. All right, if the patient really decided during that experience, I'm gonna place my collar back up with my contaminated hand, and we would let them, I'm watching my O2 probe over there, and when they get to back to where you feel like we can do another one, okay, we need to do at least 2 more if we can. But what if your patient just absolutely took them out? I'm gonna stop, I'm gonna get respiratory therapy or somebody a little more advanced than me to come in, because he did not tolerate that well and I need to do some more care. So we'll just get some expert input. All right, so then once we get our second pass, we'll do the same thing again. We're gonna do 3, sharp shoot, and then try not to touch the chest, cough, 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 so then we can intermittent swirls coming out. And then we'll do one last run after he resaturates. Last time. Feeding in. Resistant. So swirl, swirl, swirl. All done there. So then everything becomes a trash can. I would disconnect there. All the things can just ball up in one and we'll have one big trash pile. And so, but for sake of saving resources for practice, we're gonna fast forward. We clean that up. Now, I have that inner cannula out for a long period now, right? And that's not the best, so we're gonna have to try to be as quick and timely as we can. The first thing when we get re-sterile is to, where did I put R? Where did I throw that? Do anybody see where I threw the inner cannula when I took
It's
it out?
on the note stuff.
Thank you. Is it? Okay. For all sakes and purposes, you're going to have a sterile package. Do you remember how we reused your J loops for IV? You had the sterile package to open. You're going to have one extra sterile package to open. That's going to be your replacement cannula. That'll be your first job in as soon as you get sterile before we do the rest of the care. And change the type. All right. So depending on your kit, I think most of you have this one. Is that the one you have? So I'll use this one for now, and then we'll check out our other kit just to say we looked in there. All right. So I'm going to open this one towards me because it's so small. I may throw those little cotton swabs out, so I'm going to have good control when I open this one. I'm going to open towards me. Go ahead and remove that. Trash. And then there's your sterile gloves right there on top. So we'll use our other ones. Next thing that's included in there, we're going to talk through our kit first, is your drape. You're welcome to use this. Which side, shiny or
Shiny down.
shiny side's going to go down. That's your water barrier. If your kit does not have this, you're okay to also place just a towel or what other clothing protector your facility may have. Some of them have like the Eat at Joe's Crab Shack bibs, surprisingly too. So you may see all kind of, but we will place our barrier down. You're going to have some standard gauze mixed in with your cut gauze. So if you don't have cut gauze, remember you're not going to make yours, but the dry gauze is going to be to if they have copious amounts of mucus or stuff coming out, or when we elicited that cough reflex or suction, they start coughing up and all that, you've got some gauze to wipe it away. And then you're going to have your swabs, which is going to be the only thing to stay, because once I add water, think about nothing can stay inside of there. So we're going to work out of our kit first, and then we'll get all of our things. So this one's actually one of the harder ones to work with because of where you have to put your water. So we're going to put the gauze in there. All right, also thinking about other options. What else could I do with that drape if I'm going to use the towel for my patient?
Use it as a sterile kit.
That's my best recommendation to you, is to use a towel to keep the patient clean and use yours, because the small of this, but does that make sense to you guys that if I try to pour water, you can't do that sterilely? So my recommendations, take your gloves, get sterile. And the other thing that's got to happen is we have to open up our other package. So we would sterilely open that blue and white reusable, which this isn't going to tear right, but we're going to say it did. And then I would flip that over into my sterile field. Can I use that one as is?
No.
But for sakes and purposes, we had the actual correct packaging and it landed just so, like that. All right, moving on. Get sterile the second time. And what did we say the first job was? As soon as you got sterile, you're gonna place your inner cannula back in, and then we'll keep cleaning. That's your first job. You good?
Yeah.
I just want to make sure there's not a question I'm missing, because it might be a good question. Everybody's favorite part. I think y'all heat seal these just for me. All right, we'll get that out of the way. First job is going to be to get our little cannula here. Go ahead and replace him, and I'm not even going to touch, so I will stay sterile. Line up your blue dots. There should be a place to insert, and then you go until you line up your blue dots, it'll click. Then we're going to take our sterile field. Shiny side goes down. Teeny tiny. Just go around. All right, then we can take out all of our things. We're going to get rid of that dry gauze in the middle. Just the plain 4x4s. And we'll get our swabs. They can just go floating, and then our strip right there. Now, I did not think ahead. No, it's really because I just want to show you that some kits may have a solution they don't. Who do you have at bedside?
An assistant?
Yeah, thank you. And I was like, anybody gonna talk to me? So one of my lovely care assistants is going to open our pre-used bottle. Who would like to be my care assistant? Stephanie sounds great, thanks. All right, so she's gonna lip our bottle, and Stephanie's gonna sterilely pour some water over into my swabs there. All right, so they can just go swimming. All right, it is. Now, I did that to also talk about this. Why do you have to leave your swab sitting stick out?
Because now you're dipping your hand back.
Because I'm gonna get wet, and then what do I need next? Something that's dry, so I might cross-contaminate. So I do that to paint you another picture. So when you're placing your swabs, had I done it as we should, but I like to show you because you helps remember. You're gonna have your sticks on the edge, but where your sterile surface is in the boat and can grab some water for this particular kit. Then, we're going to take as many swabs as it takes. We're not gonna, every patient will be different, but obviously I'm gonna get dirty. But what do you think the dirtiest place, or the place that I absolutely wanna clean is? Around the stomach opening. So this is where actually my other hand's gonna contaminate. So you're gonna have to learn to be a little ambidextrous for this skill. So I'm gonna start about in the, what would you say, 9 o'clock position at that stomach opening, and I'm gonna ride up to 12 o'clock. I would toss that away, and I would get our next swab. And then I'm gonna start at 9 o'clock and go down to 6 o'clock. Wiping away, toss, that would be done. And then we'll get our next one. I'm gonna start up at 3 o'clock and come up to 12. That would throw away. And then you can get, again, which, do you see what the difficulty is gonna be? So you're gonna have to learn which feels good to you. And 3, go down to 6. So I technically swapped. Y'all see I contaminated. I would have to redo all of that. But it just gets you to think about, I need you to experiment at this point with what's comfortable, because you are gonna have to reach across and grab that other swab. So you can be here, but just depends on what feels good to you. But once you've done your 4 swabs, is all we're gonna do. Then you could use your dry gauze, which with every hand remains clean. So you can blot dry if there's a lot of other secretions. The dirtiest area is typically going to be at the bottom. Gravity is going to pull everything down. You can also use your additional swab if you are nice enough to have 5. You can clean the faceplate if there's any buildup, but we'll talk about that when you start practicing. But your dry gauze is going to blot everything, really go good there at the base. For your sake and purposes, all the sterile work is done after the clean. So this next part, just do the best that you can, because I know it's hard and you're all up in their face and that sort of thing. Try not to, the best of your ability, touch the part that's going to go down towards the patient. So we're going to create some bunny ears. Since I touched this side, I'm going to protect this side. And then I'm going to go under and try to place the gauze. Hardest part in the world, it's right there. Try to just get you a corner under that tie up there. And then same on this side. And once you get your little bunny ears. You can kind of position them under that little plate. And like I said, this patient was very tightly tied. So just make the best effort you can. I know when we do them, most now places have the Velcro and they're much easier to work with. So next and last is going to be your little shoestring. You're going to want to look for your corners on there that will already kind of pre-rolled, and so that can kind of help you feed the next one. Another easy way to know that you're removing the old one is to start on the side that's opposite of the one that's currently tied. So I'm going to try to use this little corner piece here to get under our plate, which again, the hardest part of the job, so I understand. Like we said, sterile work's done. And you can imagine manipulating this part. I'm going to try the other side just to see if it goes better. And then we have. Y'all are too quiet. Sing to me, do something.
I don't want to be on video.
So what do you think the hardest part of your part's going to be? This.
That right there.
And we'll be here all day. But.
So you have to put that on before you take the other one off.
Mm-hmm.
Okay.
Because you might lose. Another trick we've seen is if you still have a clean gauze, or excuse me, a clean swab, you can sometimes wrap the tip and feed it through. Kind of like you're sewing a needle, but may or may not work. We're going to use the, I don't have a Velcro one that's used. Y'all just going to watch me struggle. So we can stop video there because that's just a struggle at that point. It's a struggle for anybody. Again, yes, how did your patient tolerate your lung sounds before and after? Because I would now hope to hear clear. If you didn't hear clear, that means we probably need to do another set in the next 15 to 30 minutes. We'll give them 15, 30 minutes to rest and then repeat the whole process as far as suctioning. You don't have to repeat the ties and the gauze except but once, usually once per shift, in some facilities once per day. Just depends on the amount of secretion. And you can always tack on the words PRN. So remember a couple options you can do for your drape. But let's look at our other kit just to see how that may go.